Well, a laparoscopic sleeve gastrectomy is not a new operation, and it's not an implantable device. It's just a description of the appearance of the stomach after we've completed the operation by basically converting a stomach that's a large bag into more of a tube. There's no rerouting involved. The sleeve gastrectomy is actually part of a much bigger operation called a biliopancreatic diversion operation. It's also been used for decades as a staging operation in preparation for a gastric bypass for those individuals that were felt to be too old, too sick to survive a potential complication of a gastric bypass. And so this procedure was done to downstage that risk with the intent that they would go back to surgery in 9 to 12 months to have the completion of the Roux-en-Y gastric bypass. But what we found is that the majority of these patients lost a significant amount of weight and kept it off so that they did not need the second stage of the operation. And so therefore, in the last 5 to 7 years, it's become an acceptable first stage or initial operation for those folks with excess weight. It's indicated for adolescents who have excess weight in order to prevent the comorbidities that are often present in people who have a tremendous amount of excess body fat, such as diabetes and high blood pressure and sleep apnea, high cholesterol, and things of that nature. But it's also indicated really for any age range as long as the benefits of the operation outweigh the risks. Well, the patient generally needs a body mass index of 35 or higher, and this number is simply a ratio of one's height to one's weight. It's an imperfect scale, but it's the best one that we have currently, and the easiest way is to go to any one of a number of websites and have that number calculated for you online. But if your body mass index is 35 or higher, then you qualify for any of these operations. Well, the laparoscopic sleeve gastrectomy is chosen in those individuals who are particularly averse to the idea of having a gastric bypass. It's an acceptable alternative. The weight loss is almost as rapid as with gastric bypass. There is good control of diabetes and other comorbidities, although not quite as quickly as we would see with a gastric bypass. It's also a good choice for those people who are very large. It's a safer operation. It still gives us the option at a later date of completing a gastric bypass. But anybody who really needs to lose an inordinate amount of excess body weight and eradicate some of these comorbidities, who are averse to having their intestines rerouted, it's a great option for them. The sleeve gastrectomy is a very safe operation. It does have the complications of a potential staple line leak and potential post-operative bleeding. What we do here at Jupiter Medical Center is intraoperative endoscopy at the completion of the operation to pressure test the staple line to make sure that it is airtight. It also gives us a food's eye view immediately in the operating room so that we can make sure that there is good constant caliber of the new stomach and that there's no internal bleeding and that there's no air leaks at the staple line itself. So it's a very safe operation, and it takes about 45 minutes to perform, and the typical hospital stay is overnight. Most people go home the afternoon of the first post-operative day and are back to work in 7 to 10 days. There's not a big incision to recover, from which to recover. The puncture wounds are very small, the largest being a ½ inch in length, and the internal pain is very minimal. The biggest thing that we deal with immediately after surgery is some nausea, and so we start pre-treating people the night before surgery for that side effect. But it's fairly short-lived and is gone in 24 to 36 hours. The advice on how to use this tool, which is really all we're providing, is a tool. And I use the analogy, it's just like a hammer. You can use it to drive a nail or smash a window. It's not the hammer's fault how you choose to use it. So we do show these folks how to best use this new stomach to the best advantage. And that's involved in the preoperative education process. About 90% of the patients do keep off the weight long term. We generally see about 50% excess weight loss at 6 months, and 75 to even 80% at 1 year after surgery. But for everybody that loses 100% of their excess body weight, there's another person that has only lost 25 or 30% of their excess body weight. So it's a lifestyle change. It has to be maintained for the rest of their life for them to have that ongoing effect.